Well, we just heard how biotechs are transforming healthcare. Now let's talk about current healthcare policy underway in Washington. Joining me now is CMS Administrator Dr. Mehmet Oz. It's great to have you here, sir.
Thanks for having me on, Cheryl. You know, I was listening to that commentary, but a good example of how business is done right, you just witnessed. When you allow fraud in the system, you corrupt the system in ways that actually hurt the actual legitimate businesses to the benefit of folks who are doing illegitimate work. It's one of the reasons that we've been so focused on trying to fix the fraud so we have enough money to pay for all the other investments that would benefit the American people.
Well, and you certainly, I think the work that you're doing in fraud is incredible. Some of these stories that you and also the DOJ are helping to expose are just unbelievable. 455 people. $6.5 billion in false claims. I mean, these are things that I think we all knew were happening, investigations in different, but this is a whole of government approach between your agency. The owner of a mental health company who's using homeless people and profiting, this nurse practitioner in Texas, the doctor in Florida. Talk about these cases. This doctor in Florida that was screening young, healthy college athletes. These are all just, and that was, I think, what, $89 million right there. I mean, how far in are you right now into uncovering the fraud and the abuse of the system?
Well, we've stopped over $40 billion from leaving the agency. It's 40% more money than last year. So we've learned with an all-government approach, you actually have to stop the money from leaving the building by using prevention and detection, not paying the money out, then chasing after it. The codes of this country were never written to anticipate this degree of fraud in the healthcare space. COVID changed that. It taught people, some Americans, but a lot of foreigners and foreign countries and multinational criminal organizations, that the U.S. government wasn't watching the till so carefully, so go ahead and take advantage of it. So we're all over this, every arm of government pulling the oars together. The president obviously cares enough about it that he appointed Vice President Vance to lead the anti-fraud task force. All of us celebrated on Tuesday with the Department of Justice's wonderful work. FBI is involved, Office of Inspector General. But can I speak to what broader theme, the human element of this? You mentioned that doctor in Florida. This is what that doctor in Florida did. This is a young man. Now, Caden is an interesting fellow, was doing great, A student. Mother obviously thinks the world of him, like all moms do, but she had good reason to. I spoke to her about Caden. And what we learned about Caden's case is chilling. That doctor you mentioned made $89 million. The way he did it was by scaring parents into getting tests that were not needed for their kids. One of the tests that was obtained would have screened his heart to make sure he was able to play sports. He just started college. A month after the test was read as normal, he died. On autopsy, his heart, supposed to be the size of my fist, was 2.5 times larger than this, massively dilated, easy to pick up. What that doctor was doing was just churning the tests. He never read them. Within 11 seconds, allegedly, of getting the test in his inbox, he said it was fine. There's no way you could screen it that quickly. So the human face of this is, and the reality is, if they steal your money, they will steal your health, they'll steal your life. And the costs of this go beyond just the loss of life. It also affects the fundamental safety net of our nation. If we could take the health fraud out of the system, it's about $100 billion a year, we would double the life expectancy of the Medicare trust fund. Think about this, Cheryl. Everyone watching right now is counting on Medicare to be there for them when they retire many years from now. That Medicare trust fund, many Americans feel, will not survive that long. If we double its life expectancy, it's going to be there for you, your kids, your grandkids.
Medicare is the story, and Medicare has got to be around, you're right, for our children and for our grandchildren. You were speaking at a conference, I believe in Maryland a couple of weeks ago, and you were talking about these 5 different areas in Medicare and in healthcare in general where we can make it more affordable. Everybody wants to see healthcare become affordable. Affordability is the topic for the midterms this year. Fraud, waste, and abuse is one thing, but you pointed out drug pricing. I want to ask you about Trump RX right now, but also, preventative health and nutrition and deregulation in this space. Talk more about that.
So let's start off with TrumpRx.gov. This is a spectacular program. It's yours. The government built it for you, the American people. Doesn't cost you money to use it. If you go into a drugstore, you must go to TrumpRx.gov to make sure the price you're being offered by the pharmacist or your however you're getting it is the best price out there. This is the place we're putting all the medications that we have negotiated most favored nation drug pricing. And as a reminder, we used to pay 3 times more for the exact same drugs that were being made here, often here, as foreigners were paying for those drugs. No more. We now get the same price, best price around the world is offered here, as the president has requested and demanded. Insurance companies have been willing to do this now. And again, we're not price fixing. We're not limiting their ability to innovate and save lives, which I think is very, very important for our nation to preserve. But they have voluntarily given back $600 billion of value to the American people. And that Trump RX website that you're watching scroll next to is built by the National Design Studio. Ed Korstein, Joseph Jebbia, who built Airbnb, built this site. It's spectacular. Fast, accurate, works. You can even geo-target the best prices in your neighborhood. So it's a price transparency site. So that's one big bucket that we're very proud of. That's going to make drugs more affordable, because 1 in 3 Americans, roughly, will leave a pharmacy empty-handed because they cannot afford the medications, which, Cheryl, as you know, if you can't afford your meds or your health care, you don't feel like you own a part of the American dream. So these prices, as you're watching, are going to help you with weight loss drugs, the so-called fat shots, as the president calls them. It'll help you with fertility medications. Insulin is discounted on this site. So it's there for you. It's the America's website that the president made for you, and it's in your inbox if you desire to look at it. Second big bucket is MAHA, the secretary. And I'm with the secretary. I'm in the Health and Services building right now. He's focused on the MAHA movement because we know if we can prevent disease, that's how we'll really save money. The reason why the healthcare system is so expensive in this country, roughly twice as expensive per person than any other country on the planet, is we're twice as fat. Cheryl, let's call it out. If we're heavy, it costs more to take care of you, and you develop more complications from things like hypertension and diabetes. And those complications are strokes and heart attacks and dementia and kidney failure and liver pathology, all these things you don't want to have to deal with. So if we can get you to lose some weight, it makes a big difference. Starting July 1st, seniors on Medicare who are not previously able to get these GLP-1 weight loss drugs can get them for $50 a month. So there's a lot of opportunities that we're giving you to make healthcare more affordable by actually using technology and lifestyle changes to reduce the major drivers of healthcare costs, because 70% of all the costs are driven by lifestyle chronic illnesses.
Yeah, no, and again, that's the excitement around GLP, is that you bring down obesity rates across the country, and eventually you bring down health insurance rates. And that's, I think, the biggest thing. Real quick, I need to ask you about the Ebola virus. We're now seeing more cases, and now they're saying this new strain is over in Europe. They're finding. How worried are you about Ebola maybe coming to the United States, to our shores?
Well, I trust Jay Bhattacharya, who runs the NIH and the CDC, who's been meticulous in his follow-up of this. He handled the hantavirus beautifully. We had no cases in this country. He is confident that we have programs and backups to those programs. But this is a bad virus, and the global movement of human beings can create risks, and there's always a possibility. But I trust Jay to have done everything humanly possible to ensure that our nation is protected.
And a doctor first you are, and wanted to make sure we got your take on all of that. We're going to be watching all the work that you're doing. Thank you so much for being with us, Dr. Oz. It's great to see you.
Bless you, Cheryl.
All right.